And when something is bad, we say no together.
Week 2, and it seems the National Health Insurance Fund drama is slowly coming to an end. The government has bowed to pressure from the public, the Federation of Kenya Employers and the Central Organization of Trade Unions, opting to suspend the new NHIF rates for the next 3 months.
This is a wonderful scheme, for sure. But issues of operationalization of the scheme, the capacity of the scheme, and I think the issue of that board was what this side, COTU and FKE, had questions about. I want to agree with Kenyans who have raised issues about this.
And with that, the nationwide strike that was scheduled for the 14th of this month in protest of the new health insurance scheme has officially been called off, as all stakeholders are being brought to the round table.
The way this scheme was being implemented and the way the rates had been gazetted, there were no consultation.
We all agreed that this may be a good scheme, but is being rushed. So there is need for us to step back and just allow time for a rational review of what we want to do as a country.
The 3-month consultation will be carried out through the new interim National Health Insurance Fund board that was constituted yesterday by the Prime Minister. The interim board will be chaired by Professor Mutuma Mugambi, and Medical Services Ministry Deputy Secretary Aden Aden is the board's interim CEO. The government is yet to name the representatives from the Office of the President and the Office of the Prime Minister, while the Kenya Medical Association, COTU, NAT and FKE are yet to field their representatives in the board.
Do we have facilities in hospitals, in dispensaries to support this scheme? I think that will be something that must be assured before we can go back. And if the 3 months is not enough, although of course this team has to work very hard, we will have to go to the drawing board.
The government and stakeholders within the health sector seem to be speaking in one voice. At the same time, pressure is mounting for Medical Services Minister Professor Anyang Nyongo to resign.
The Minister for Medical Services, having shown inclination to protect and or to cover up those at the helm of this scam, must be suspended forthwith,
so that we get clarity on this parastatal that we have been talking about for the last several years.
But there's nothing we're really hiding in the Ministry of Medical Services, nor is there anything I as the Minister would like to hide regarding the NHIF fare.
Minister for Medical Services was in Parliament today, where he stated that he will issue a ministerial statement on Tuesday next week over the NHIF scandal. Catherine Omwando, KTN Prime.